Good evening, everyone. This is Casey Ulrich with the National Nurse-Led Care Consortium, and on behalf of the National Nurse-Led Care Consortium and the American Association of Nurse Practitioners, I would like to welcome you to today's webinar, The Role of NPs in Practice Transformation and Payment Reform. Before we get going, I'd like to take a quick moment to introduce you to NNCC and AANP. The National Nurse-Led Care Consortium is a membership organization of over 250 nurse-led practices, and our mission is to advance nurse-led care through policy, consultation, programs to reduce health disparities, and to meet people's primary care and wellness needs. The American Association of Nurse Practitioners is leading the way in advocacy, continuing education, and professional development for over 60,000 NP members. NNCC and AANP have partnered to create the Nurse Practitioner Support and Alignment Network, or NP-SAN. The NP-SAN is supported by the Centers for Medicare and Medicaid Services, CMS, of the U.S. Department of Health and Human Services through a National Cooperative Agreement grant. The information presented in this webinar, its contents and conclusions, are those of the presenters and should not be construed as the official policy of CMS or the U.S. government. Today's webinar is being recorded and will be available in the upcoming week on our NP-SAN portal page, as well as through a link emailed to all registrants. All participants will be muted throughout the presentation. I encourage you to submit questions throughout the presentation. Please use the question tab on your GoToWebinar control panel, as seen here, and ask your question. It will be relayed to the presenters and answered at the end of the presentation today. A survey will pop up at the end of the webinar and will be sent in an email later today. Please take a few minutes to complete the survey evaluating this activity, as your feedback is critical to the ongoing development and presentation of our webinars. We have one handout prepared for today's presentation, which you can access via the Handouts pane in your control panel. You can click on the handout and it will be downloaded via the default folder in your web browser. Again, my name is Casey Ulrich, and I'm the Director of Practice Transformation and Quality Improvement with NNCC. I'm also the Director of the NP-SAN program, a program of the Transforming Clinical Practices Initiative. Before I turn things over to my colleague Jan Towers, I want to take a quick moment to go over that Transforming Clinical Practices Initiative. I'll provide a brief overview of the TCPI, its structure, and how it can help nurse practitioners facilitate practice transformation in advance of payment reform. I'll go a bit through the goals and structure of the TCPI. So, the TCPI is CMS's largest ever investment in practice transformation, around $700 million over the course of 4 years. CMS has funded NNCC and AANP to support enrollment of nurse practitioners into practice transformation networks and to develop NP-specific educational material that facilitates practice transformation. NNCC and AANP are the only nursing-focused grantee of the TCPI project. NNCC and AANP agree that this initiative is important to ensure NPs receive the support they need to remain competitive in a changing healthcare landscape. NPs are the future of primary care in the United States and already provide high-quality and cost-effective care. This initiative is an opportunity for NPs to prove it by helping CMS and the broader healthcare community build the evidence base on practice transformation. So how does the TCPI function in practice? The TCPI project is a national coalition of funded networks that provide free quality improvement and other training services to clinicians and their practices, NPs, physicians, and other qualified providers. There are two types of networks, which we'll get into in a little more detail later. The practices work together with their peer clinicians to improve quality and achieve milestones in a predetermined change package. How that technical assistance is delivered and the specific goals are different according to each network. The ultimate goal, though, of all networks and the TCPI is to help clinicians and practices transform their practice and succeed in a value-based reimbursement environment. So we'll talk a little bit more about the TCPI and how it can help you and your practice. But in this next portion of the webinar, you will get a chance to learn about the MACRA payment reform legislation, a foundational principle of the TCPI, from Jan Towers, a founding member of AANP and health policy expert. Dr. Towers has been active in the area of health policy at the national level for 30-plus years, working on behalf of NPs and their patients to facilitate appropriate utilization and support for NP practice. So, with that, I will unmute and turn it over to my colleague, Jan Towers. And Jan, I'm also going to give you control of the keyboard at this time.
Thank you. Hello, everyone. Next slide, please. Okay. In the beginning was a flawed fee-for-service Medicare reimbursement program, which we all have been struggling with. It has a flawed formula that had to have what we called a doc fix every year to make it so that we could be paid at a proper amount for the Medicare services that we provided. The framework for that system was a quantity, not quality, and of course this increased cost of Medicare, and it is felt led to much Medicare fraud. Next slide, please. Then came the idea that maybe we could create a system that was based on value, which we called a value-based purchasing or reimbursement system. And some of you probably remember back as far as Senator Kennedy and President Clinton, attempts were made to create some problem, make some transitions, but there was no potato. We just couldn't get it off the ground. There was always some reason why the attempts would be stopped, delayed, whatever. Next slide, please. Then, last year came the birth of MACRA, the Medicare Access Chip Reauthorization. And the legislature passed this last year, just several months ago. And this piece of legislation provides for the transition to value-based purchasing. It repeals the flawed SGR billing formula, creates new billing formulas based on quality, and removes fee-for-service, and moves toward a team-based alternative payment plan. Next slide. The big deal here for us is that nurse practitioners are on the ground floor. While legislation is focused on larger entities, so that entities such as Mayo, Cleveland Clinic, Geisinger, places like that really fit this model more comfortably, they have been making sure that they focus on small practices, particularly people like NPs, to make sure that they're included along with the physicians. And this has happened both with the repeal of the SGR formula and with the payment designs that they are attempting to create at this time. We have given feedback along with physician and other healthcare provider groups to various ideas and proposals as they begin to work on this grand experiment. One of the other things is that attention, as I said, is being paid to small practices and other provider groups. So they are creating things like TCPI to help us make the transition to value-based purchasing. One of the other things that was in this piece of legislation that is very important is that nurse practitioner practices are recognized as medical home practices if they meet all the criteria in this piece of legislation. So when it calls for medical homes, our practices can compete with the physician practices in relation to that. Next slide, please. There are within MACRA two payment models. the merit-based incentive payment system called MIPS, MIPS, so you want to remember that acronym. The advanced alternative payment model, which they call APN, which should be easy for us to remember since it hooks into our initials so much. This is being created at this time, so it's still somewhat fluid. We have a proposed rule that we are all responding to. And so what I will be talking about is what is being proposed at this particular time, and because of the time framework here, we can't go into this in depth, but at least it will give you an umbrella framework looking at the model that is being proposed. And what we'll find is that most nurse practitioners will probably be involved with the MIPS, the merit-based incentive payment system. Next slide, please. The measurement components for the MIPS, there are 4 of them, and one of them is related to quality. 50% of your score will be that. One is resource use, which basically is cost, and that will be another 10%. The clinical practice improvement activities, 15%, and advancing care information, 25%. These 4 areas, the scoring on them will create a formula and a composite score that will be added to your base score and determine your payment in the program. Data collection starts in year 1, which is 2017, and that is where nurse practitioners will be starting as well. They will have a choice of starting in 2017 versus 2018. Then the scores that you get, if you are good, you'll get more than your baseline. If you're not good, you'll get less than your baseline, and there are a whole bunch of formulas that tell you how that would work. And you collect data in 2017 for payment 2 years down the pike, similar to the PQRS framework, so that you're always working for the future and in the present. The quality score, the 50%, is really pretty easy. It's similar to PQRS in concept. You choose 6 measures from a proposed list. That one of them must be an outcome measure, and one must be a crosswalk with other agencies. But there's a fair amount of flexibility, and as we reviewed them, there are very few quality indicators that you would not be able to use, and you certainly will be able to get their minimum of 6 that they have called for. The resource use, which is the 10%, what they will be doing is comparing costs and resource uses across practices, and that will then, you will be compared to a cross-practice framework in relation to developing how you use your resources. The clinical practice improvement activities are something that I think nurse practitioners will be very comfortable with. You choose an improvement activity, and they have a whole slew of them, like about 90 that they propose, and they're things like that we all do all the time. It's like safety, care coordination, creating checklists to follow certain conditions or certain issues within the practice, and that will count for 15%. And then advancing care information, which basically is EMR use, which will be adjusted for nurse practitioners, they say, because we were not part of the initial incentive groups that got money back in the beginning. And since we have not had that advantage, they're looking to find a way to make some adjustments so that we don't have to meet the requirements, particularly in the first year or two. We do not have anything in writing as to how they would do that. What's being discussed is that that 25% would be distributed to the other resources, quality probably being the most logical one, and again, that really should not create any problems for us as we look at it. Change slide, please. The advanced APN model is really for groups that incentivizes existing advanced models and includes things like shared savings or other ACOs, the CMMI, medical home, which I think many of you are familiar with, and other federal demonstrations. And in this case, the evaluators will be related to the use of EMR technology. Base payment will be based on quality. And it does require entities to bear more financial risk or meet the requirements of the medical home model under CMMI, which are, again, is something that nurse practitioners can do very well. Nurse practitioners may be providers in these entities, and so it's important for you to be keep up with what is happening with them as well if you are in those entities. I would reiterate that these are proposed rules. Nothing is written in stone, but this is the direction that the proposed rules are being planned, and this is what they're spreading and talking to all of us about. Next slide. So the importance of MP participation and leadership in practice transformation is, I think, pretty obvious, and that's what they're going to be talking to you about tonight. Bottom line is that we now, can you take to the next slide, please? We now have 222,000 nurse practitioners licensed in the United States. In 2016, they made 870 million patient visits, and 83.5% are prepared in primary care. A significant number, I think it's like 85%, actually provide care to Medicare patients, and a similar percentage provide care to Medicaid patients. While this is a Medicare program, we know that the Medicaid programs will be picking this up down the pike, and of course in the usual trickle-down effect, we will begin to see this same framework showing up in the private pay framework. So it's wise to become prepared and knowledgeable in this area and to make sure you're in it. So for starters, if you'll turn to the next slide, please, there are some things that, you know, in terms of the rationale for why you're there. You need to get paid, and this is the way it's going to go, so I need to get on board. There is nothing in any of this so far, we watch this very carefully, that you cannot do from the standpoint of ability, and we're making sure that all the doors are kept open so that you can walk through those doors, but what we'll need is for you to do that. Much of this transitioning is focused on physicians who really are not as grounded in quality care as we are, so it's really a much bigger adjustment and more uncomfortable adjustment for them than it will be for us. The networks that we discussed tonight, that you discussed tonight, are things that are geared to help you, and they made a point of establishing networks here that are looking at nurse practitioners and advanced practice nurses and not physician focused, which so many of these networks generally tend to be. A couple of things that you need to do right away. I assume everybody listening has their MPI number, but if you don't get it, you also need to get your Medicare billing number if you have not done that. And then you need to be watching for directives and guidances. Our e-bulletin for AANP, we try to keep up with putting things out for you and giving you reminders and showing you where some things are. Medicare e-bulletins also are full of information and guidances that can be utilized. You also, if you're an employee, want to watch what's happening internally. You are going to be needed. There's no question about that in this system. But you do need to be sure you're at the table in your practice, and things aren't happening around you without your input. In conclusion, I would just point out to you again that we are currently reviewing these proposed rules. We're giving feedback. Our feedback is being received. We have seen many things change because we say, hey, wait a minute, what about this, what about that? We want feedback from all of you as you are moving in the direction of picking all of this up. And with that, I will stop and let them go on and tell you more about this program.
Thank you very much, Jan. I really appreciate that. Again, this is Casey Ulrich with NNCC. And Jan, I think, gave a great overview of, payment reform, what it might look like coming out of the MACRA legislation. And I want to go back just quickly to take a look at this, the MIPS measurement component slide that she went through. And Jan made it clear that this is right now just the tentative plan for MACRA. This is not the final version. But one thing that we think that the TCPI program does very well is help prepare clinicians to succeed in value-based payment structures, because it supports some of these very aspects here, the general aspects on reporting on quality, reporting on resource use, engaging in clinical practice improvement activities, and making use of health IT products. If that's something that your practice is able to do, you will be well prepared to succeed in any value-based payment structure. Whether it's MIPS, whether it's through a private payer or state Medicaid, and I think that's what we're really focused on here. So I want to talk a little bit about the TCPI structure and how it can help nurse practitioners prepare for MACRA, whether it's MIPS, whether it's an APM, or, like I said, a different payment reform structure. So this is just a quick visual representation of the journey a clinician and their practice would take as part of the TCPI and as a member of a practice transformation network. So there's an initial focus on setting of aims, the collection and use of data to drive care, to achieve progress on stated aims, to eventually achieve some benchmark status on certain quality measures, and then, like I said, the end point there being able to thrive as a business in a pay-for-value environment. These are the lofty goals set by CMS for the TCPI program over 4 years. As I mentioned, it is one of the largest ever federal investments in peer learning. They would like to involve over 140,000 clinicians and their practices, improve health outcomes for millions of Medicare, Medicaid, and CHIP beneficiaries, reduce hospitalizations and unnecessary testing to generate savings to the federal government and commercial payers, to transition practices into alternative payment models, and continue to build the evidence base on practice transformation. And in particular, that's something that we would like to see done on behalf of nurse practitioners. So this is a roadmap to practice transformation, the TCPI change package. The purpose is to guide clinicians and their practices to achieve the goals of the TCPI project. The change package that you're seeing here is incorporated into technical assistance and used as a framework to organize and develop education and training curricula. It's a dynamic change package. It's changing according to best practices, and it can be tailored to each practice, and their evolving multi-directional goals. It's grounded in what's been working, and it was developed based on interviews with successful practices across the country. So these concepts and strategies have been used by practice leaders in high-performing practices. And practices are able to choose which areas they want to focus on. So you can see that the main drivers are around person and family-centered care design, continuous data-driven quality improvement, and sustainable business operations. So, and then in the right-hand side are the secondary drivers for each of those, and then CMS has also developed change tactics that further branch out from those secondary drivers. So this is really the backbone of the TCPI Technical Assistance Program. And I wanted to take a quick moment to throw up a poll. So we'd like you to take a look at the change package and think about which of those 3 primary drivers do you think are most important for you and your practice. So I'm going to go ahead and launch this poll. And I'll give you about 30 seconds to think through, which of those drivers, person, family-centered care design, business operations, data-driven quality improvement, which one is most important for you in your practice? Which ones do you think require the most work, where maybe you could use technical assistance the most? And what do you think would be really critical in transforming the way that you deliver care, and how could they help you prepare for a value-based reimbursement structure? So we've got a lot of people who are chiming in. If you haven't, please choose one of those three. If you don't think that any of them apply to your practice, or if they're not the right driver, you can feel free to skip it and maybe bring it up in the comments or the question section at the end. All right, so we've had about a minute, and it looks like most folks have chimed in. So I'm going to go ahead and close the poll. And reviewing the poll results now. So about 54% of you chose person and family-centered care design, and the secondary drivers under that around team-based relationships, population management, working as part of the community. 20% chose continuous data-driven quality improvement, and about 26% chose sustainable business operations, and 86% of you voted. So thank you very much for your feedback with that. And I think that is, again, speaks to how NPs operate in terms of working as partners in the community and as partners in care. So I think that really speaks to how NPs operate. So go ahead and close that and get that out of the way. So when thinking of the TCPI, how does it work on the ground? And the practice transformation networks are the networks that provide the boots-on-the-ground services to enrolled clinicians. So if you're interested in possibly participating in the TCPI, what you would do is you would enroll with one of these networks. There are 29 of them across the country. Some are focused on a particular state or region. There are a few that have a national focus. As I mentioned, they are the ones who are providing the boots-on-the-ground services. I can't go into the nitty-gritty of what each one provides because there are 29 of them, and they have 29 different individual sort of service packages, but there are a couple commonalities. All of them conduct a thorough assessment of your practice, where you are in relation to some of those change package tactics that we were looking at earlier, to do that sort of gap analysis and identify where you need to beef up certain aspects of your practice. Other services include things like access to data warehousing tools, access to individual practice and quality coaches to come in and look at things like revenue cycle management if that's where you have a gap, or quality improvement initiatives, PDSA cycles for certain aspects of care. And all of them require that enrolled clinicians that are a part of the TCPI participate in certain online meetings, possibly an annual in-person meeting, and engage in quality work and share a basic amount of clinical data with the network. So each PTN, again, has different expectations for enrolled clinicians, but they are flexible and they try and be as minimally disruptive as possible. Again, most practices will need to designate one person as the primary contact for the network, and they'll be required to participate in trainings, calls, and webinars with their practice transformation network. These PTNs will provide individualized support and services for clinicians and their practices, and the only restriction is that a clinician and his or her practice cannot be enrolled with a Pioneer ACO or a Medicare Shared Savings Program. But if you're unsure, it's worth reaching out to us or to a PTN and determining if you are in fact eligible and if your practice is eligible. And they are enrolling primary care as well as specialty practices. So support and alignment networks, that is the role that NNCC and AANP are providing. We are while PTNs may be pushing practices through the steps of practice transformation via direct technical assistance, the SANs, our networks, pull practices along by aligning continuing education content with the TCPI and making the TCPI a part of maintenance and certification activities, and using other ways to encourage participation by clinicians that we work with. So while we are not enrolling clinicians directly, we do serve a vital function in raising awareness of the program and helping connect clinicians, in our case, nurse practitioners, to networks that fit their need. Some of the other SAN grantees include the American Board of Family Medicine, the American Medical Association, the American College of Physicians, but like I mentioned, NNCC and AANP are the only SAN devoted to nursing. So over time, we will shift from raising awareness and recruiting of NPs into practice transformation networks to creating NP-specific continuing educational content to help NPs move through the TCPI change package that we looked at earlier. Eventually, with the final goal of helping NPs achieve practice transformation and demonstrating preparedness for payment reform. So in particular, how will TCPI help prepare NPs for payment reform and some of the changes that Jan went through earlier? NPs that are enrolled with the TCPI will not only benefit from their programming, but will also be able to provide some feedback into the shape that payment reform may take. So as you follow along this line of, of MACRA into the TCPI prep, NPs that are enrolled with a practice transformation network will have a say in the identification of quality measures or quality indicators and the rollout of measurement systems, which is critical to making sure that payment reform honestly captures the quality of care that's being delivered by nurse practitioners in the field. Data sharing is a large component of this project. The practice transformation networks will want quality data from their enrolled clinicians, and it's a great way to start capturing, validating, which is a critical step, and then sharing data in preparation for payment reform. So for our project goals, again, working together, NNCC and AANP, we want to raise awareness of this TCPI program among NPs so that you know it's out there, that it is a resource that can help you prepare for changes coming in the healthcare landscape. We want to recruit over 7,000 NPs into networks, into one of those 29 networks over the course of 4 years. We want to create a space for NPs to be able to discuss and have a say in the structure and the future of payment in this country. We want to provide networks with NP-specific CE resources to support the engagement of clinicians. And we want to help develop the TCPI related content specifically for the NP community so that NPs that are involved with the TCPI have the educational resources that they need. So we think that NPs have a key leadership role to play when it comes to practice transformation. NPs can definitely help PTNs by serving as leaders in their networks. As Jan mentioned, NPs are often more familiar with many aspects of quality improvement, as well as some of the drivers of the change package that we had mentioned. NPs have experience working in collaborative, interdisciplinary, team-based environments. Nurse practitioners are also very experienced when it comes to participating in peer-led quality improvement activities. And, and fundamentally, nurse practitioners and nurse-led health centers understand the importance of long-term sustainability and the critical aspect of payment structures in helping determine the sustainability of care over time. As Jan mentioned, the TCPI is worth noting because it did include NPs as a foundational partner in this project. In the past, NPs have many times unintentionally been excluded from federal quality improvement or payment reform initiatives. Things like fee-for-service or PQRS often took a bit of time to recognize the importance of NPs and to include them in their structures. As a result of this, participation in many of these incentive programs are still lower than those of physicians. So we see the TCPI as an opportunity because, again, NPs were consciously chosen as founding partners in this process. CMS included NPs in the design and implementation of the TCPI and funded our project to make sure that NPs were involved. And it represents a real opportunity for NPs to shape not only this very large federal program, but also, again, to shape certain aspects of the payment reform process going forward. One thing that we think will really help NPs as they participate in the TCPI is that the TCPI embraces certain principles of nurse-led care. When we looked at the change package before and some of those drivers, when you break them down, they're about things like patient and family engagement, improving team-based care relationships, practicing as a community partner, making sure that you're using organized evidence-based care, that you're enhancing access to care through accessible locations as well as accessible hours, that quality improvement strategy is supporting a culture of quality and safety, and that there is a workforce vitality and joy in work. These are all aspects of nurse-led care and one way that NPs will be able to succeed as partners in the TCPI. So we believe the TCPI really can support NPs and nurse-led care through resources. So, through the practice transformation networks can provide critical resources for practice improvement and transformation. The inclusion of NPs and their practices in PTNs can also provide access to larger networks of clinical peers for nurse practitioners, especially for those that are maybe working in smaller clinics or in rural areas. And practice improvement through the TCPI is also focused not just at the clinical level, but across the provider network. So you'll know that if your practice enrolls, those quality improvement training services are being provided not just to you, but also to your colleagues in your practice. And that means that improvements could spread to all members of the care team, which is oftentimes something that's critical for NPs who may not have their own panel or may be somewhat dependent on their colleagues when it comes to certain aspects of care. So that's also very critical. So if you're interested, how do you get involved? Again, our NP-SAN project is here to connect nurse practitioners to networks that have the correct geographic and population focus. That's one aspect of it. We also look for a network that has the right mix of technical assistance and training services for your practice, a network that has the right clinical quality improvement focus as well, and the right clinical quality measures that are relevant to your population and your population mix that you serve. So if you'd like some more information, there are a certain number of ways to get involved. One very easy way is to go to the website that we've set up right there on the screen, AANP.org, to learn a little bit more and to get connected. Another way is to join the healthcarecommunities.org website. That's the main portal page for the TCPI. And if you were to join the TCPI community, you'll receive updates on what's happening with PTNs. You can learn a little bit more about PTNs and how they operate. And you can join our nurse practitioner SAN page while you're there to get connected and to contact us. And then finally, if you just want to shoot us an email, you can contact my colleague at AANP, Chantal DePape, or you can contact me at the email address below. So that's just a quick overview of, again, the TCPI and some of the payment reform processes that we're seeing coming. So at this point, we would love to take the remainder of the time for questions. If you have a question for Dr. Towers or me, please type it in the question tab on your GoToWebinar control panel. I'll give everyone 1 or 2 minutes to put those in. While that's happening, I want to take a moment to bring your attention to 2 events that are coming up. AANP is hosting its national conference June 21st through 26th in San Antonio, Texas. The conference will provide expert faculty presentations of current, practical, and clinically oriented evidence-based practice information. They'll provide state-of-the-art skill enhancement workshops, discuss national, state, and local policy issues affecting NPs, and provide a space for networking opportunities. Another event that's coming up a little bit later this year is NNCC will host its annual meeting, Fostering Innovation, Sustaining Transformation, from November 8th through 11th, 2016, at our offices in downtown Philadelphia. The meeting provides an opportunity for nurse leaders from across the country to gather to discuss the future of nurse-led healthcare and what we can do to sustain advances made by nurse-led clinics and nurse leaders. So, without further ado, let's open it up for some questions. Jan, I'm going to unmute your mic, and we can see what questions we have in the queue. Chantal, have you had a chance to review them?
Yes, I have.
All right, go ahead. Let's get going and get through as many of these as we can before the top of the hour.
Okay, someone would like to know if they can or if they have to enroll with their practice, or if they can enroll as an individual NP.
You want me to answer that?
Oh, for the TCPI, I'll state first for the TCPI, there are some networks that are enrolling individual clinicians. I think their focus is to enroll the full practice because that really is where, if you're talking about transforming and preparing for payment reform, those sorts of things do need to happen across the full practice. But again, that's part of the sort of matchmaking process that the NP-SAN can support. So I'd encourage you to reach out to us, and we can connect you to a PTN.
As far as MACRA is concerned, they are talking in terms of being able to do an either-or, but we haven't seen how they would work that out yet.
Okay, and then kind of a follow-up question for that. Someone's wondering if their practice is actually owned by a rural health clinic. Do they have to get permission from them to join?
For the TCPI, I would say that your clinic director may be able to make the decision to enroll in the PTN themselves. That would depend on basically your internal contracting policies and procedures. Again, there's no financial risk sharing that occurs through the TCPI. This is strictly a free voluntary quality improvement program. So it's not as if there's a cost element to it. but it would mean that all of the networks require that their enrolling practices sign contracts and statements of work, committing to certain deliverables in terms of attending meetings and sharing clinical results. So again, whether or not your individual practice is allowed to sign that sort of agreement, that would be up to, I would think, your internal policies and procedures.
Okay, and then the next question is, are these resources only available to practices that care for Medicare enrollees?
No, definitely not. If you're not serving Medicare patients, you can still participate in the PTN.
Okay, next question. Are these networks appropriate for NPs that would like to start their own practice, or is this better for NPs that already are a part of existing practice?
I think that the principles of the change package and some of the skills that the PTNs are trying to impart on practices are definitely relevant for an NP that's looking to start their own practice, especially because those business and operational drivers will be so key in terms of sustaining practices going forward. So I think it's definitely worth looking into a network if you're looking to start your own practice.
And the next question is, will CMS stop calling NPs non-physician providers with these changes?
We can hope. I think that they're getting better about that. In all of the paperwork and the materials that CMS has produced as part of this initiative that we've seen, they have not been using that NPP acronym that we've seen. And they have, again, I think, having us be a part of this as the NPSAN, they're getting better at moving away from the physician-centric lingo. So that's something we're trying to help and work on.
Am I muted? Can I speak?
Oh yeah, you're on, Jan.
Okay. One of the things you will see in a lot of the language now, which has been related to, I think, our efforts, is that they're using the clinician word. And so that's the substitute. So they are moving away from them, and they know how much we disdain that.
All right, do you have a next question?
Yes, sorry, there are lots of questions, so just give me one moment.
No problem.
Okay, next question. Will the AANP have a SPG group that helps us understand this via electronic QI data on a real-time basis?
This is Lydia Riley with AANP, and we don't currently have a specialty practice group that's specifically dedicated to this issue. However, that's something that we are considering for the future. In the meantime, I would suggest that anybody who is interested in receiving technical assistance, more guidance and education in this area, my suggestion would be to get enrolled with the Nurse Practitioner Support and Alignment Network so that we can get you hooked up to a PTN.
Okay, and then the next question is, will NPs be reimbursed at 100% or will the 85% rule remain? Also, did CMS consider PTNs for house call practices?
Well, that one's mine. Unfortunately, the 85% piece is still in statute, and so we have pointed out to them that this would be a good place to make a transition to get away from Incident 2 and start talking about a service as a service. So it's given us some power to kind of wiggle the tree a bit, but right now we still have that statutory thing. So the base payment would be based on 15% less than the physician, but then you can go plus or minus depending on the year. It starts out at plus or minus 4% and then goes up to a 9, I believe it is. You can actually overcome that, but you do have that handicap that we're trying to see what can be done about.
And the latter part of that question around home care practices, I believe they would be eligible to participate in a PTN, again, as long as you're not a part of a Medicare, ACO, or shared savings program. And generally, the eligibility requirements for this TCPI program align with those of PQRS. So that's one way to generally think about it.
Okay, and then someone said that they just recently graduated and would like you to clarify the difference between fee-for-service and value-based reimbursement.
Well, fee-for-service is when you do something and you get paid for it regardless of what you did within the framework of what you did. As value-based, there are going to be some weights put on whether you have met the criteria for being a value-based service. Those are the things that the MIPS that we were talking about. You're going to have to be able to show that you're doing all of these things with your patients in order to get extra payment. But value-based means that you're being paid on the basis of the value, the outcomes, the things that have made your care better, whereas fee-for-service never had anything like that to monitor it. So one of the big criticisms always was that people could see lots of patients and whip them through and not really provide the services they need to provide, and they'd still get paid for it. And so that's what that they're moving away from.
And the next question is, as NPs, we frequently care for marginalized and disenfranchised populations whose baseline health is poorer than others. How will we be protected and encouraged to continue to care for the sickest of the sick?
Well, that's one of the questions that comes up in relation to that, and it's been a criticism of value-based, that because you're looking at outcomes, it's possible that you will have patients that it's very difficult to really measure outcomes and have an outcome score that is going to be, I guess, satisfactory to you in terms of your ability to continue working and your pay. But that is discussed a lot, and so you'll see some of these formulas are rather complicated, and part of that is because they're looking at ways to make sure that they don't punish a provider or a patient because of the seriousness of their condition. So those efforts are ongoing, but they are something that get discussed a lot.
This is Lydia Riley from AANP. I would also just add, in addition to what Jan said, that part of the TCPI Practice Transformation Networks is a baseline practice assessment tool, which really will help you establish where you are at with regards to certain quality measures in relation to other clinicians also participating in the Practice Transformation Network.
Okay, and then the next question is, can you clarify the Medicare programs excluded? Most of my patients are Medicare Prime and others are in managed care programs.
That has mostly to do with not getting all the various payment systems tangled up. They're trying to keep some clear lines with these programs. If you're enrolled in one, then you can't be collecting money out of another. It prevents double dipping, a lot of things like that. So that's why they draw those lines, and it's purely from that perspective.
And I would say from the TCPI perspective, it's the eligibility and the exclusions are not so much based on the program that your patient is enrolled in. More so it's whether or not your practice has already signed in on as part of a shared savings program like the ACO or the MSSP, since those programs already have services and practices that are or services that are being delivered to those practices to help improve the value of care that's being provided. So in terms of eligibility for the TCPI, it's really more so about what your practice is engaged in and not so much the program that your patients are a part of. And Chantel, it's almost at the 7:58 right now, so maybe just one or two more questions. And if you have other questions, again, I'd urge you to email them to us. Jan's emails on this slide deck as well.
Yes, someone requested that you return to the slide with your email address. If you can quickly.
Oh, yeah. So that's right there. As well, again, if you click on your handouts page, it has the full slides that are available there. So you could download the slides that has all of our information on it. And we will be sending out the slides as well as a link to a recorded version of this webinar 2 days after after today. So in 2 days, we'll be sending that out to everyone who was able to register. Do you want to try and do one last question, Chantel?
Sure. Do you suggest that we utilize standardized patient data, sample patients for the highest proportionate attribute risk problems?
I'm not sure. I'm not sure I follow the question.
Yeah, you might be better off emailing that question to us. I'm sorry about that, maybe with a little more detail. Is there one other question maybe to go through, Chantel?
Yes, let me look really quickly. Yes, someone's wondering, so how does a practice choose one network over another?
Well, one way to do that, the simplest is, again, based on your geographic area, what state you're in. There are normally a couple networks that you might be eligible for. And then it's simply taking a look at some of their promotional materials to see what they're offering in terms of services, what they're requiring of participating clinicians and practices, and what their desired outcomes are. So what are some of the clinical quality measures that they're focused on? Taking a look at that, you can see, which one you think best aligns with the existing priorities of your practice, and then it's a matter of reaching out to them and working to enroll with their network. So again, that's why we're here, and we're happy to help you walk through that process. So again, I want to be cognizant of everyone's time, so it's at the top of the hour now. So again, I'd like to thank everybody for sitting in on today's event. Again, we have recorded the session, and we will be sharing a link to the archived version in 2 days, along with our slide deck. Once you exit, there will be a survey. Please fill that out, as it helps us evaluate the activities and put together additional webinars that would be useful for the NP community. So with that, Dr. Towers, thank you for helping out today, and thank you to everyone who took the time to attend.